Cheers.
After 4 months of peering through windows, soon care homes can open their doors.
Hello, Mum.
The Health Secretary telling us tonight he's about to revisit the rules.
But in the next few days, we will be setting out how COVID-secure visiting can happen in care homes and in a way that keeps care homes safe.
This is the discharge summary that actually...
But for thousands, there will be no reunion. Homes like this one have no written explanation of how COVID-19 killed so many, but believe it spread from patients discharged from hospital.
You were putting them into a high-risk environment. People want to know why on earth you did that.
No, this isn't right, Paul, because what happened was that there was infection control put in place in care homes, and you have to look at what is right for an individual. And being in a hospital, especially if you're frail, is a very risky place to be.
I appreciate that, but then the question is why you didn't test them. It does come back to why you didn't test these patients leaving hospital. It could have saved thousands of lives.
The truth is that around the world, people didn't know that there was the asymptomatic transmission.
The scientists in the UK were discussing that in January. Chris Whitty discussed it in March. You did know that there was a potential for asymptomatic transmission.
As soon as they certainly discussed it earlier, and they came up with the advice that it didn't happen. Discussing it is different from concluding it.
In fact, on Monday, the Prime Minister seemed to blame care homes for not following procedure.
I am fuming, absolutely livid.
Today, Debbie still didn't get an apology.
Can you just apologise? That's what she really wants.
Well, what I can do is I can tell Debbie and all those who work in care homes how much we value their work.
After everything that carers have been through, we can't keep paying them minimum wage, can we?
I can't make a financial announcement now, but I think you can see where my heart lies.
We're sitting down today as the true economic cost of the pandemic is beginning to become clear. £15 billion on PPE. Do you think Britain's being overcharged for that PPE?
Oh no, not at all.
You don't think that maybe we're paying over the odds because we didn't stockpile in the first place?
No, we had a huge stockpile and we worked our way through it, and then we had to replace it. But we were buying it at the same time as demand from everywhere else around the world.
Which did push up prices, so perhaps if the stockpile had been larger to begin with...
Well, we had one of the biggest stockpiles in the world.
When do you expect a second wave to hit the UK?
Well, I very much hope there won't be one. So people talk about the second wave as if it's something that's inevitable, but there's no inevitability to it so long as people keep following the social distancing guidelines.
Residents and relatives will hope he's right and that the reunions about to happen will not be short. Paul Brand, News at 10.